we had one question before about from Andrew Nikitin. Let me share it with you. Here it is. It's a bit long. Maybe now. So, which of the owners of public health data seems to be you the most reliable? The state, medical facilities, or patients? I get the general question. Who we should trust with our health data if we can make a choice? If I had to make a choice, then, I mean, looking at my own data, I have been making choices. There are some companies, private companies, that I trusted with my health data. I'm sure my Fitbit, through my Fitbit sensors, Fitbit can access 5 years of my health data going back in time. I'm sure that some of the companies I order genetic tests from, they can access my quite sensitive private information, even the results of my genetic tests. And in many cases, I check that I don't want them to sell my data to third parties, not even in an anonymized way. I have doubts whether all of them complied, and I think some of them still sold the data because they thought that genomic data could be anonymized, but I think scientifically that's impossible. There are some healthcare institutions like my primary care practice, which I trust with my health data, and I made that choice. I had primary care physicians before, but I wasn't so fine with them privacy-wise, and I wasn't so excited about their level of knowledge of technologies. But the one I having the primary care physician I have now, she's really amazing, and of course I'm happy to trust her with my health data. And then there are data which I own and I store in my own systems because I think I trust those services and those basic technologies like Google Drive in a password protected way that I use day by day. But there is no clear-cut answer to this, and you are definitely not in a position where you can make the decision whether you want all your health data to be in one place or in the hands of one company or one healthcare institution. That's not going to be the case. But the more you know about this, maybe the more you can prepare to avoid your data being leaked to third parties or bad actors. So thank you for the question. Just for a moment, I would love to jump back to an issue that I wanted to talk to you about, which is more about the second level. You know, let me go back to where we were before. We have been tackling and talking about the traditional, maybe 25 minutes were enough about that. Let's talk about the new, the technologies that you use and the privacy you have on those technologies. And I wanted to share with you how I experienced this myself as a patient, maybe a patient from the future. Because these are and I just do a compilation now. These are the technologies that I use quite often. Like I have a sleep tracker, so I have my sleep data, my sleep quality stored in the cloud through a third-party service. I've been using a fitness tracker, a smartwatch for more than 5 years now, so I have that data stored on a Fitbit account. I've been using some devices to measure stress. I've been using some headbands to get better at meditation by getting immediate feedback. I've had now about 6 genetic tests, and one of them was a whole genome sequencing, so my full DNA is available, DNA information is available through that service. It means 6 companies can access my sensitive piece of information through my genetic results. And I even had a microbiome test with 3 different services. So can you imagine in how many ways my data is leaking? You might think that I do this a bit too much, but the reason why I have to test so many services is that now I can tell you which ones are accurate, which ones are safe and reliable, and which ones are not. This way we can also talk about the privacy issues that actually most of you will have in the near future. You will be able to avoid using such services, but then you have to say out loud that you are fine with whatever information your, for example, a primary care physician has about you. And even if you could obtain a bit more about your risks for conditions genetically, your diet based on your microbiome, your fitness level every day, but you choose not to. So the data they have about you is enough for you. And that's your choice and your right. My right is that I want that data to be used in medical decision making when it comes to my own medical case. So I make a decision here. First, I have to decide how much of my privacy I'm willing to give up in exchange for a chance for a longer and healthier life. So even though I use all these services and measure all these things about myself, it doesn't mean that I will, live longer and healthier than you. Maybe I have a chance, but that's not even certain. So that's the best decision, the best balance we can keep here. And I'm sure that my privacy is leaking, but at least I feel like I'm the one still making a decision about this. All right. Let's go through the questions. And thank you so much for being with us here. And I really thank you for the many questions. I'm trying to go through